Hi, Rosemary.
Hi, Ani.
I'm
How are you?
I'm doing great. I'm so happy to have you here. So today we decided to get together with Rosemary, and as when I met her, I was just completely impressed by her and what she does. So we decided to get together and do something little short information because the clients we work with as practitioners, we see that clients, their pain and where the pain originates are so different. And our approaches are so different, right? And that was
Yes,
like amazing for us to find out.
yes.
So today I thought, you know what? Let's have Rosemary to share her magic, how she works with the clients. And then afterwards, I'll share what I see and how I work with the clients, which is so interesting because there is no one technique or one approach is going to work for everyone or is the best approach. It depends, what the clients we're working with. So I'm like so excited to hear what you have to say, the information you have to share. And so I'm going to introduce you, Rosemary, the Hands of Life by Rosemary, and that's your company. You are an author, a Reiki master teacher, and also an angel communicator, which is so interesting since I just started about to read the book, Angels Speak. So I would love to afterwards maybe discuss it with you. So I'm going to hand the stage to you, and please go ahead and share.
Thank you. It's a pleasure to see you again, Ani, and to share what I do as well with you. So one of the things I know is that when someone comes with pain, it's a multifaceted kind of situation. A lot of our pain we hold is emotional. Some pain is maybe from injury or from illness, but I believe that a lot of these things manifest in our bodies for many different reasons. And as a Reiki master teacher and working with energy since 1997, a lot of clients come to me with stress-induced situations in their body, a certain pain that won't go away. And many times when I'm working with someone, I begin to realize, because I know about the chakras and the system of the body, that many of people hold pain related to repressed emotions that they can't let go of. For instance, I've had someone come to me with a breathing issue and she believed it was asthma, and it could have been. She was treated for asthma. But when I'm working on her body was telling me something really different. She told me the body, the information I get when I'm holding the body was more related to a stress-induced situation with someone yelling at her all the time. And I actually felt the body kind of tighten up and seize as soon as I touched the area below her breast, which is known as the solar plexus or the confidence area. And her body was holding this pain of screaming and yelling. And I didn't say this to her. So after the session, I just said, is there anything you want to tell me about what you might be going through right now to, work on releasing this issue? And what she said was her husband screams at her all the time. She's really afraid of him and she wants a divorce from him. And what she was doing was manifesting this breathing issue and this tightness in the chest area from fear. After she left him, magically her asthma disappeared. And, it was more related to her emotional result than it was her actual body illness or condition. So the body holds pain as a signal to us. So we have many different energy centers in the body, and in yoga, they call it chakras, but in the system of Reiki, which I work, it's simply an energy center that is around the nerve bundles of the body. And as a body worker, we work really with the 7 main ones related to the physical form of the body. So for instance, if someone has an eating disorder or something related to an addiction, many times the first chakra, which is the root, which is the lowest chakra in the body above the physical sexual areas, that is the survival chakra. And when it's out of balance through fear or I'm not feeling safe in the world, sometimes people will develop an addiction to make them feel safe. So they might overeat, or they might get pain in the lower area of the body related to the sexual organs. It may be related to abuse. So there's lots of different things that can manifest as pain and discomfort when the chakra is actually screaming that it needs love and help and healing. And of course, healing can come many ways. So we have our emotional healing from counseling and from body work and from balancing the system. And we also have it from giving the body self-love and understanding and healing related to the emotions that are stuck in that part of the body. If someone has, let's say, colitis, many times colitis is from overthinking, and that's our second area of the body known as the sacral chakra. Many times when people ruminate a thought again and again and again, it manifests as that unsettled feeling in the gut. And as you know, we make a lot of serotonin, about 85% in our stomach region. So not only does it put the stomach chemicals out of balance, which is helpful with, herbs and healing and the right foods, but also that emotional imbalance. Whenever someone gets upset, the stomach will start going, and you'll get the butterflies and the colitis or the runs or withholding, which is the constipation. So all those areas relate actually to the emotion in the stomach area, which is I can't let this go, or if I let it go, then I'll be out of control. So the two opposite ends of that would be like diarrhea or withholding. And at the very least, it's that stomach upset feeling that people get when they're upset with a situation. And as you move up, we have our confidence chakra, which is the one I mentioned first, and that's the third one under the breastbone. That area holds how we feel powerful and creative. And many times, if this area is out of balance, it also will relate to the stomach and the first chakra energy under that. Because if you're not feeling confident, if you don't feel like you have power in the world, many times it'll elicit fear, and the fear will go down into the lower area of the body and create distress. So not only do we hold the emotional distress, but it'll manifest as then go into the denser form of the physical field of the body. There's been interesting information on PubMed, and I was looking up information on Reiki and on healing and on light. And one of the things that they do know, and they've done testing on, is that our cells hold light in them, and there's light around them, and that's called bioluminescence. And when you are in emotional wellness and physical wellness, the body emits more light within the cells and around the energy of the body. And this is something that they photographed, and it's something that's been tested. You'll also know, like, the heart makes a pattern when it's feeling happy. If you go to HeartMath organization and look up their information, they relate to the heart energy being like a wave when it's happy and static when someone is under stress. And that static creates energy in the body, and it creates imbalances in the organs of the body when it's out of sync. So the chakra for the heart is known as the fourth, and that is the way that we express love in the world, and we accept love. So the chakras also relate to energy, emotion, and body systems. Since they are around the nerve bundles of the body, they're not only in the front, but they're also in the back and relate to the spine and the back of the body as well. So if someone has a lot of back pain right behind the heart energy chakra, I often ask, is there anything that you need to release from this area? And I help them by sending love into their heart and by expressing themselves through maybe some toning or some voice work. And I have a friend of mine who's a sound healer, so I might send them to my sound healer friend. I have friends that are counselors. So if I know it's an issue related to, let's say, an addiction or distress, I have other friends and people I know that I refer to for that. If it's for body testing, I would send them to you. So there's lots of different things that we do to help each other. The throat holds issues of communication. If someone has thyroid issues, a lot of issues related to expressing themselves, many times they'll get polyps in the throat. They might get neck pain because this area also relates to judgment and also relates to expressing our truth. The fix for this communication center is linking back with your heart center and find what the message of your heart is and the energy of your heart. What do I really want? How can I express it with love? Expressing it with screaming, that's an out of balance throat. So we don't want to do that. So it's really get your angst out and like yell and scream when you're alone. And then when you're calm, you could talk to the person and express yourself with love. But before that, you're perfectly fine if you want to throw something. All right. As long as you're not aiming at anyone. So you want to get the anger out and express all your emotions, and it's perfectly fine. But then come back to center, come back to your heart energy and love energy and express it in a different way. The energy of the next chakra relates to visions, seeing, second sight, and also kind of like our dream center. And our dreams hold lots of information. Many times when I'm working on this chakra, I might actually get like a vision of someone's childhood, or I might see, let's say, a scary memory they had that they're holding. Sometimes it's even in the back of the head. When I'm working back here, sometimes I'll get a quick vision of something that frightened them as a child. I might see like a big adult or someone screaming or a scary room. And those are all related to memories in your past, or memories that you're holding in the back part of your brain as like a pattern, or a locked away memory that you haven't released. And that could manifest as headaches, vision in one eye being off. So there's lots of things that can happen in that area. And then the last one is just the opening to the information that we allow into us through prayer and through connection with divine. Illnesses manifest in many ways. People that are resonating with a higher frequency of love energy and better heart resonance heal faster. They've done things in hospitals where someone has a cancer diagnosis, and those people with optimistic mindsets and a more upbeat feeling, they will heal quicker, and they won't die from something as quickly as someone who feels very sad all the time and depressed. Depression is a killer. And people that are living in that lower vibration state are more apt to get sick. They're more apt to be hit with colds, flus, and diseases than someone more upbeat, because we have more ability to withstand different things. We have more resilience, and resilience comes from being more in balance. Couple things that I suggest when people want to get themselves in balance: they can do a salt bath in Epsom salt. They can do a water cleanse. So even though they're showering, they can intend that any energies collecting on them from other people or from things they heard can be released. You can use oils like frankincense or Palo Santo oil on your temples, top of the head, and on the back of the neck. Those are protective oils, and they help highly sensitive people when they're in crowds. Listening to positive information, listening to music is very uplifting, and it helps put the body back in emotional resonance. Whenever a pain comes up in my body, the first thing I do before I run for an aspirin or a pill, I'm like, what am I holding in my body? So if I have shoulder pain, I'll say, oh my gosh, what am I shouldering that I need to look at, that's making me feel like I'm overloaded. The body is very strange. Like our left side is our emotional side, and that's a lot of our female kind of energies. The right side is our strength and our male energy. And I'm going to, go ahead and take on the world. So many times, we should be in perfect balance, but many times we rely on one or the other. Highly emotional people are very much in their left. Many times they're stuck in not making a decision because they don't know what to do to move ahead. Knee pain, very common. Left knee pain is an emotional fear that blocks you from forward movement. And right knee pain is often, I know what I want to do, I'm going to push through, but I'm not quite sure what my next step is. So the body will hold different things depending upon what it is that's bothering us. So some of the things that, I suggest to people is, first thing, make sure you're drinking enough water and you're eating properly. Try to get rest. Take care of yourself through self-care. Do body things like Reiki and other things that you think may help you. Use your intuition. Make sure you check with your doctors, your therapists, whoever your medical people are, or your alternative people, and see what your gut tells you, who is guiding you the best way. And if there's several people, make them part of your wellness team, people that can help you in a different way to solve a problem that might be blocking you. So that's a big mouthful of stuff I just said.
And I loved it because it was so interesting as you were talking about emotion and like screaming. I am type of person, if I'm upset, I could yell and scream or express myself, let my anger out, and then I'm done. I
Yeah.
don't dwell on it. I don't, I'm not one of those people like a week later, they're still like, oh my God, this is what happened. Like, I'm done.
Yeah. Yeah.
And so I can see, and sometimes in my office when I see clients and I'm working on certain areas, all of a sudden they have this emotional release. I'm like, ooh, there was something holding. But I never do the level, like the point where you come from, because mine
Yeah.
is more like a science based, even though I love,
Mm.
sometimes I do watch like documentaries that there is scientifically, they did proven that, around the cell, the light, it actually exists. It's not a theory,
Right.
it's amazing. I love it and I believe it. But my approach, sometimes when I'm working with the client and my background is, bachelor's in kinesiology. I'm a pain resolution specialist, medical massage practitioner, functional nutrition, and then nutrigenomics, translational nutrigenomics practitioner. So I look at the body, and I love when you said, we look at the body from a variety of angles. There is no like, oh, it hurts here, let's work here. And sometimes when I see patients, especially if they're brand new patient to me, and they came to me because the only reason you will come to me that you're in pain. And most of the time you've been to different practitioners and you still have your pain. There wasn't a sustainable result. So as I'm listening to them, their symptoms, and then when I start working, sometimes I work in an area and some they would say, that's not where it hurts. Or some, they don't say anything, but from the look of their face, they're thinking, okay, yeah, that's not where it hurts. So I'm like, yeah, I understand that's not where it hurts, but that's where your pain is coming from.
Yes.
Because that's what, I studied. And I love when you mention, on the spine, where your nerves come out of your vertebral column, I use different approaches like dermatomes. I would use dermatome chart, which shows what nerve, and I have this really nice chart, but I'm going to share my screen and just kind of show real quick the dermatome chart that I just kind of put together. So, the C is the cervical vertebrae, and then T's are your thoracic, lumbar, and sacral. And as you can see here, let's say if you come to me and you have neck pain, and then you say, okay, but I'm also feeling, I may go work, on your hand, on your forearm somewhere, because there could be a referral pain, especially if it's a nerve pain. If you have like a neck compression, cervical, like a vertebrae compression, or a stenosis, even though there's not much I can do about stenosis, but somewhat I can help with the pain. But then when you have the referral pain, it will give me an idea of exactly what vertebrae it's coming from. So I kind of put together this dermatome chart where it actually tells you, okay, the cervical. So if it's C2, you will feel the pain, lower jaw, back of the head. It's like, it's almost like a cheat sheet.
Yes.
Now, for a regular, people that, if you're a practitioner, this is gold mine for you, because it's like a cheat sheet. You can refer to it and diagnose when you're at the diagnostic stage of when you're seeing the patient first, or at the treatment stage. It will give you a great starting point. Now, if you're a person that's been living with pain and you've gone to practitioner and you're not getting any results, this would be just kind of a helpful thing for you. Like, okay, I have pain, I'm feeling pain here, but maybe my pain is coming from here.
Yes.
Then, it's sometimes when you're a person that's been living with pain for a long time, and this is in my almost practicing 3 decades, I see that the patient sometimes knows a lot more about their condition, about their pain, because they have done so much research.
Yes.
That they're just full of this knowledge.
Yes.
So when I was studying, I love pain resolution, and that's one of the reasons I got into this industry, and then started branching out into nutrition and genetics, because we would see, patient have pain, but the root cause of their pain is somewhere else. So when I was back in college, back in Armenia, former Soviet Union, that's where I got my degree, which later I reinstated in United States. But we also studied medical massage, which continued in US from an amazing Russian doctor, an MD, which also teaches currently, I think he's in Arizona. He teaches medical massage, but the knowledge, the background is fascinating. So, I refer to, depending on the client and the pain, the referral source could be different. Like dermatomes is just one of them. Okay, that's because of the nerve. If there is a compression where the pain can refer to. Most common one people know is the sciatic. I love it when the client comes and says, I have sciatic pain. Like, where do you feel it? Oh, on my thigh. I'm like, okay, that's impossible. That's not the root of the sciatic nerve. Okay, let's figure out. And then I show them the chart. It's like, okay, most of the time, if you're feeling on top of your thigh, it's your femoral nerve, because it starts between the L2, lumbar 2 and 4 vertebrae. And the pain pattern, it would be top of your thigh, which years ago when I injured my back, top of my thigh was numb for about a month. As I injured, and then I was treating myself with the tools I have, like a cold laser machine, and then some other tools I have to calm the nerve down, and of course the ice and stuff. But it lasted for about a month, and then that was about 6-7 years ago, and I haven't had any issues since then. But like knowing that, it was very valuable. So going back to when I was studying the medical massage, even though I call it Russian medical massage, because in United States, if you study unless you're studying from Dr. Turchininov, a regular, like other massage schools, if they teach medical massage, you don't get this background. Which in the late 1800s and early 1900s, there were Russian doctors, scientists or regular MDs, that they've noticed that their patients, when they're coming and they're complaining about the pain on their muscles or the skin or the discoloration changes on their skin, they realize that, okay, these people have internal organ dysfunctions, let's say digestive issues or kidney issues. And the pain was manifesting on their outside of the skin or a muscle. So they put together, there is the kind of like my cheat sheets I go by, that there is head zones, and head not has to do with head, it's a head, it's the doctor's name, Dr. Head.
Dr. Head, got it.
And then there is the Dr. Galiko, I think if I'm pronouncing it properly, Dr. Galiko and Glazer, which in early 1950s, they took this other, they were German scientists, but they took this other Russian scientists and doctors' work, and they kind of created the Galiko and Glacier zones. And those are the cheat sheets I have. And I got all this because I took the Russian medical massage from the Russian doctor, it's like there's like head zones. And
Right.
it's almost like there's cheat sheets, or we're looking at the Glacier and Delico zones. Let's say if you have intestinal disorders, it gives you like a marker, okay, where would be the pain? And then the pain would be like in the skin, or in the connective tissue zones, or in the skeletal muscles. And you can follow and find out where would that be. That's why I love this muscle organ connection. I'm going to share my screen and
That's
show
awesome.
another chart that I put together. Let's see, this one. So I put together this kind of like a reference to muscle organ connection. So the stomach, if you have any digestive issues, these are the muscles can be affected, like your pectoralis, like chest muscle, your neck flexor muscles, which is most of the time it's in the front, like your sternocleidomastoid, your scalenes, your brachioradialis muscle, which is on your arm. Okay, then we go down to bladder, any issues. Then you could feel pain at the tibialis interior, which is like the front of your lower leg muscle. Then a peroneus muscle, or sacrospinalis muscle, which is like goes alongside of your spine on the back, erectors of spine. It's just so interesting.
It is.
If people have any kidney issues, then it's the psoas muscle can get affected. Your upper trapezius muscles, your iliacus, which is kind of a part of the psoas, right here, the flat muscle. And then we go to lungs, has to do your serratus interiors, like in the side, it kind of goes into the innervate in your upper ribs, your coracobrachialis, or the deltoid, like a shoulder muscle. And I'm sure, like Rosemary, when you're looking at this and the stuff you do, like sometimes the correlation would become like very similar.
It's fascinating. I was just looking, when you mentioned the psoas, a lot of people hold emotional issues in the psoas, especially related to relationships. So the right and left psoas will flame when there's an issue relationship-wise, male or female, in the hips. So that was interesting. And the other thing that you mentioned, I had blown my disc back in 1999 and I was paralyzed to my knee. And again, I didn't take medication. I did, the exercise, all the things you said, the ice, and it healed, and I haven't had a problem since. But the radiating issue was down my leg in the front, and it was paralyzed and frozen, like cold, cold, cold. So I knew it wasn't getting any energy to that knee. And eventually, like within a month, it was gone. But it was bad, for a couple of days, because I didn't have bladder control for like 2 days. It was bad.
Yeah. So then, those are the different, the organ muscle connection points. And then depending, there are healing for touch. I think there's a practice where they look at the neurovascular points. And the neurovascular points, a lot of them are located on your scalp, on your head. Be like different sutures, or could be, like I have all these like references.
That's so interesting. I know the Indians do something with the rubbing of the head near the fixed
the
points.
Sutures.
Yes.
Exactly around the sutures, releasing it. Yes, like if you put at the, let's say right above your umbrellas glabella, I guess and then that correlates with your peroneus muscle. But just all you have to do, like sometimes when I'm working in the office with the clients, when I find the spot, and sometimes I have them to isolate, if they can, to isolate that muscle, like contract it. And let it go. And then I'm holding the spot. And what I'm feeling for is kind of like a pulsation under my fingers. It's a different pulse. It's not the pulse of the pulse we know it. It's not the heart pulse. It's a different pulse. When I'm feeling, once I start feeling that pulse, it's so interesting. Sometimes the patient, all of a sudden, they would either yawn or they take a deep breath. I'm like,
Yes.
oh, that just
You
released.
got it. Yeah.
And what it does, it brings more circulation to the muscle, to the area, and relaxes. Or sometimes if there is a spasm, we just release it that way. And the client goes like, okay, what did you do? You were just holding the spot. I'm like, I don't know how it works. It just works.
I believe my massage therapist, she hit the still points back here, and I felt it down in my toes. Like you just felt this all of a sudden, and I'm very energy sensitive. So whenever she hits a spot, like I can tell her where it's going, but right down to my toes. It's like it just released the energy. It was beautiful. So I know exactly what you mean when you get that,
Years ago, I had a client, and she was the only patient that I've ever had as experience with her. Wherever she would get a release, her whole body will shake. And the first time that happened, freaked me out. I like totally like got so like scared. I'm like, you don't say it, but in your head, you're thinking, oh, what did I
Did
do?
they have a seizure, right? I know.
And then, but she knew it. She's like, oh no, I'm getting a release. That's a release. It was like, that was so cool.
I've seen that with 2 patients I did Reiki on. And the first time it's like her whole body was like, whoa. And the other one, the same thing, the body shook. And I'd seen it once before, so I knew it was okay. But still, like, you don't have seizures, do you? I usually no, but yeah, it's so strange when it happens. But it's just such a nice release. And
it is, and I love it, there was a doctor, and he wasn't a manual therapy practitioner. He was actually a scientist, researcher, a doctor who, since in 1970s, he used to publish articles on microbiome, and they used to call him the quack doctor. And now everywhere you look, it's all microbiome,
yes, he's
Dr.
ahead of
Paul
his time.
Yannick, unfortunately, he passed a few years ago, but I used to study with him. And one of the things we would do, his approach was, it's all about balancing the body. You don't, it's like, I love when you were mentioning, and my hand right away went earthing. Earthing,
Yes,
balancing, standing
absolutely.
barefoot somewhere on grass, dirt,
Oh yeah.
sand, ocean, anything earth, because Earth's electromagnetic field and our brain waves are very similar wavelength. I think it's
Yes.
8.3 hertz.
Yes.
So I love doing earthing sometimes in the morning.
Me too.
I would get my coffee and go. If it's too cold for me to be barefoot, at least I just put my hand on a tree. And that's it. And
I do
even
the
that,
same.
like 5-10 minutes, I just like holding. I know one day I was doing that, and my neighbor came out. He goes, "Are you holding the tree up?" I'm like,
No,
"No, I'm
just
just
checking.
earthing myself."
I've done that. And pine trees are great for clearing energy as well. But I've done that. And also I have an earthing mat, which, if it's in wintertime, I use it under my computer.
Well, actually, I have one right under my feet. My feet are on it. And
Yes.
I had for my bed, my earthing mat for my bed. Actually, I have to get a new one because I overused it. But yes, I use those. So those are amazing. But, so with the doctors, Yannick, I learned we were using the neuromuscular palpation points.
Okay.
Just balancing those points.
Yeah.
Again, it goes back
that.
to the, on the muscle, what organs are connected and what nerves innervate. And once we relax that, okay, I want to clarify something. Let's say if you have kidney issues, your kidneys are not functioning properly, massage is not going to help it. That's not what we're saying.
Right.
We're
Absolutely.
talking about at the energetic level.
Yes.
Like, okay, when you have digestive issues and you have pain, let's say on your leg, sometimes I would make the connection. Like sometimes I have clients who come to me with the lower back pain and they're constipated. They have chronic constipation.
Yes.
I don't care how much work I do on your lower back, your pain is not going away unless you address your digestive issues, the reason why are you constipated. This is what I want to clarify, that this is what we're addressing too. You know, you're not going to have lung issues like a COPD or something, and a massage is going to miraculously heal that. No, it
And
may.
that's the thing. That's why we have so many different options. And I think when you get like alternative people and medical people kind of all working on different things, there's something that's going to put it in balance. And it may take a team of different techniques if someone's really out of balance to make them feel better.
Exactly.
So, you know, it's not a miracle. Nothing's a miracle. It's all part of putting the body back.
Exactly. It's all about balance. So today we just wanted to share a little bit of information to empower you with some of this knowledge that, you know, if you are someone that is dealing with any issues and you haven't been able to find a solution, maybe this gives you some information to look further into it. Or if you're a practitioner, maybe this will empower you to become a better practitioner to, you know, help more people achieve long-lasting success. So, Rosemary, how would people connect with you?
So the easiest way is info@rosemaryd.com, which is my email, or you can go to my website, rosemaryd.com. And you can see it. I have some videos on there, and you can always contact me. You could set up a free discovery session if there's an interest in what I do. And I work both virtually and in person. So I do different types of techniques, and I'd be happy to meet with whoever would like to. So yours is so fascinating, Ani. I'm so glad to hear what you actually do.
I can talk to you.
Very cool.
I can talk to you for hours. Like we need to set up another time just to like dig deep, and like I get so excited. And if anyone would like to learn a little bit more about what I do, or if you have any questions, the best way is my website, which is loststopforpain.com, and 4 is a numeric 4. I do have, like Rosemary said, I do have also some resources that you can download or watch the videos, the techniques. And if you like to book a complimentary 15 or 30-minute sessions, you can book it through there. I would love to help you or answer any questions you may have. Beautiful. Thank you so much, Rosemary. This was fantastic.